Project Fear thing, Claire, there was selective coverage from mainstream media. So we had reporters going into intensive care units. Now, we had cameras, the Hart Lane incident in New York, the burial island for poor people in New York. I mean, do you think But what we didn't get was reporters going into a home where someone had a mild COVID and had fully recovered? Do you think this gave a pretty distorted picture?
Absolutely. I mean, if you think about it the other way around, you think, oh, could they have made this look any worse? I really don't know what else they'd have done. Really, honestly don't. So, yes, they were filming the trenches on Hart Island in New York. So Hart Island is a place where forever they have buried in mass graves people who couldn't afford funerals. And there were more burials like that in 2020 than in previous years, but not loads more. So there were over 1,000 in 2018, there were just over 2,000 in 2020. And that means, that when you look at that, you think, well, that means they could at any time go and film those mass graves and scare people, because they were always happening, they were always there. And that difference does not account for the 27,000 extra deaths that are alleged to have happened in New York. And we had New York officials tweeting at one point. The tweet got retracted, but he tweeted into public saying that they were going to have to use New York public parks as burial grounds because that's how bad it was going to get. So, yeah, that was really scary. Of course, people were scared by that. And then we also had the BBC, whenever there was somebody young who died, the cameras would all point at that young person, and there would never be any caveats about the fact that this was mainly a problem of the elderly dying, or at least older people dying. The young one at minimal risk, but if there was ever any link that could be drawn, then there was massive attention put to it. Now, I'm going to not remember the boy's name, but do you remember the 13-year-old boy called Ishmael somebody? I can't remember his name. So the press did put a lot of attention on a 13-year-old who died in the UK, who was buried alone. His family weren't allowed to attend the funeral because they were isolating because he'd had COVID. And this was absolutely heart-wrenching at the time. And then last year it was revealed at an inquest that the reason this 13-year-old boy had died, tragically, was because of the doctor trying to get the tube into his trachea missing. And so it was a horrible medical accident that was the result, that he resulted in him dying. It was not COVID killing him, but it was reported as if COVID had killed this 13-year-old boy. And more attention was given to that death than to so many other deaths that were much, much more representative. And so, yeah, there was this massive distortion in terms of what went on. The other massive distortion, of course, was when women who were pregnant or had just given birth died with a positive COVID test, because that's incredibly heart-wrenching. Just to ever think about a mother dying at that point is just so emotive. But the fact is that women do die around that period, and they have often, pregnant women or recently pregnant women who die have respiratory problems, because a lot of the complications of pregnancy lead to respiratory problems. And in the past, a number would have been attributed to influenza. And whether or not it's caused by influenza or it's just that they've got a pneumonia and they're run down and they're on ITU and influenza's in ITU and they test positive. It's a similar situation. And, COVID may also have made it worse for pregnant women. But it wasn't so much worse. The numbers involved were tiny, and the emphasis was just so completely perverse and distorted because they're heart-wrenching, because of the emotional draw.
We could do that with anything, couldn't we? We could have a national monitoring campaign for anaphylactic reactions to ibuprofen, Brufen, a simple anti-inflammatory. And we could zoom off with film teams and say, well, this is Anna. She took an ibuprofen, and then 10 minutes later she was itchy and her skin turned red and she had to be admitted to hospital for adrenaline. You could do that, but it doesn't give a balanced view. We've got people taking ibuprofen all over the world all the time for a bad knee or whatever it is. We could do this distorted.
Yes, totally. And I think it's really important for people to understand that although the word flu is always like bandied around as something that people complain too much about. It is a lethal problem, and that people have always died of it. And it used to be called the old man's friend, didn't it? The GPs would call it the old man's friend.
Pneumonia was, yeah.
Right. So, that it was disproportionately people near the end of life where that was the last sort of thing that tipped them over the edge.
Yeah, yeah.
But young people, even children, would die of influenza every single year. And it's horrible. It's really, really tragic. And when you've seen that, it's just, you can't ever think of the word influenza in quite the same way. But that does not mean that the public are wrong to dismiss it, because the risk to any individual is absolutely tiny. And so to just, live your life not worrying about influenza is the right thing to do. But, that doesn't mean that it never caused harm. It did cause harm. And so when you don't realise that influenza had always killed people, then when a new respiratory virus comes along that seems to take the place of influenza, you're not subtracting what would have gone on before in order to make a fair assessment of what this new one means. If this new one was treated as if it was something completely different to the respiratory winter viruses we see every year, and it wasn't. It was just a different label for what had always gone on before. And there were absolutely years where influenza deaths created, the sort of excess mortality that we've seen in 2020 with COVID deaths. 1989 was a terrible year. 1991 was a terrible year. The year 2000 was a really bad year. And yet we just sort of lived with it because that's what you do. And also with influenza, the death toll would be reset. You'd have a season of influenza deaths, and then you'd say, right, on to the next one, and would start again. With COVID, counting never stops. It will never, ever stop. It's just always going to be added in.
Such a simple point, but I hadn't really thought of that. 1991, I had influenza, and I came home from work. I wasn't feeling well. I thought I'd go up to bed, and I made it to the bedroom floor. I couldn't get into bed. I was lying on the bedroom floor thinking, well, if I die now, that would be fine. I felt so, I think it's the illest I can remember feeling. It was terrible. Mm-hmm. It took a couple of hours later, I sort of just about managed to get into bed, and I just felt so ill. It was unbelievable.
Well, the thing is,
it's not a minor illness.
Yeah, when you realise that is how a healthy person can be made to feel, and then you realise that there are people who are not that healthy who are getting these infections. Then you sort of start to sort of make more sense of it, because the reality is that a lot of the people who died with a COVID diagnosis, that was the last straw for them. And for those people, when you've had relatives die slowly, obviously some people die quite quickly, but when you've had the relatives die slowly, you see how they get to a point where their reserve is so low that any urinary tract infection it might be, or a cold is enough to tip them over the edge. But the question then is, well, why are we calling that last insult the cause of death? That shouldn't be the cause of death in somebody is dying from something else. That is just the tipping point. If we started registering every urinary tract infection that caused the frail to have to be tipped over the edge, then we would have this epidemic of urinary tract infections, which would just be utterly ludicrous. And what happened with COVID was ludicrous. So we had a situation where there were 3,000 people who died in hospices. So their deaths were very, very expected, whose deaths were attributed to COVID. It doesn't make sense. It's as if nobody has really stopped to think about what a death certificate should be telling you in terms of a time frame. Do we want to know what caused that person to die on Tuesday instead of Thursday? Or do we want to know what caused them to die this year and not last year? And that's a completely different answer.
Seeing so many people die days or a week or two after hip fractures, so common in the elderly. Maybe less so now with the internal fixations, but it was really common. We used to see, but we didn't say they died of a hip fracture.
No.
Although that was the trigger of the death. I think there's a wider issue here, Claire. The effects of fear on belief. Do you think that was a major factor? And
I do.
Fear affects what we believe. I think that's true.
Yeah, and I think I wasn't I experienced it myself. I was scared at the beginning, and so having been scared, you sort of notice how your behaviour changes around that. So I was hooked on the news, and we'd go and try and get the latest death count each evening, my husband and I. And I remember it really vividly. I remember that period in April where every day we were looking, and it wasn't yet lower. You know, it sort of plateaued for a few days before the first day when the number of deaths were lower. And like, oh, finally. And you sort of feel this sense of relief over a number on the news. And so when you're occupied, like when your brain's occupied with fear, you're looking to check for danger, because that's what we're designed to do in an evolutionary perspective. You know, if there is a sense of fear, you have to keep checking for danger. And if you find evidence of danger, like a number on the news, then you can say, right, I'm right, and I should be scared. And you reinforce that fear. And the analogy that I use in the book is actually a slightly strange one, which is about falling in love. That when you're sort of infatuated with somebody, your brain is on a different gear, it's on a different level. And you end up with these intrusive thoughts that you're, you know, just out the blue intrusive thoughts and obsessive thinking. And I think you get the same when your brain is on the fear level. Yeah. You have intrusive thoughts that, you know, you're just busy doing something and then suddenly you're scared again. And you start to obsess about any little thing that you might be able to do about it. And we somehow sort of got obsessive compulsive disorder as a world all at the same time. And it's horrible seeing how many people are still suffering from that. They're still in that place all these years later.
It's fascinating. I won't go into it, but mass psychosis is a fascinating area, mass psychiatric illness. I think just before we leave this one, I think shame was another one, Claire, wasn't it? People were told not to infect their granny and kill them.
Oh, absolutely. Shame was completely manipulated. And yeah, absolutely. And
manipulated is the word, isn't it?
Yeah. And there was this feeling, I think, you know, rational people I would talk to who kind of understood that, you know, probably some of these things they were doing probably weren't going to be working. And they also fully understood that they were not at risk themselves particularly, but they were doing it all because they were worried about being accused of spreading it to someone else. So it was the embarrassment and the shame that if somebody else they knew caught it and they were responsible or thought to be responsible, they'd be, why weren't you doing this? Why weren't you wearing your mask? Why weren't, you know? So they were going to obey everything just in case they'd be embarrassed.
Mm-hmm. A bit like some politicians, really.